Question 1. A 55-year-old male with a history of chronic alcohol use presents with confusion, nausea, and a fruity odor on his breath. His laboratory results show an elevated anion gap and metabolic acidosis. What is the most likely mechanism underlying his symptoms, and what is the appropriate treatment? Choices: A. Increased NADH-NAD+ ratio, treat with fomepizole. B. Increased acetyl-CoA diversion to ketogenesis, treat with ethanol. C. Decreased NAD plus NADH ratio, treat with thiamine. D. Decreased fatty acid oxidation, treat with methanol. E. Increased gluconeogenesis inhibition, treat with disulfiram. B. Increased acetyl-CoA diversion to ketogenesis, treat with ethanol. Explanation: the increased NADH-NAD+ ratio resulting from ethanol metabolism leads to diversion of acetyl-CoA into ketogenesis rather than the TCA cycle, causing ketoacidosis and metabolic acidosis. Treatment with ethanol is appropriate as it acts as a competitive inhibitor of alcohol dehydrogenase, preventing further conversion of ethanol into toxic metabolites. A. Fomepizole is used for methanol or ethylene glycol poisoning, not for alcohol-induced metabolic acidosis. C. Thiamine is crucial for treating Wernicke-Korsakoff syndrome in alcoholics, but does not address the metabolic acidosis caused by ethanol. D. Methanol is used in methanol poisoning, not for ethanol-induced acidosis. E. Disulfiram blocks acetaldehyde dehydrogenase and causes hangover symptoms, but it is not used to treat acute alcohol-related acidosis. A 40-year-old male is brought to the emergency department after an alcohol binge. He has confusion, blurred vision, and difficulty breathing. His laboratory results reveal elevated lactate levels and a metabolic acidosis. Which of the following statements regarding ethanol metabolism is true? Choices: A. The NADH-NAD+ ratio is increased, which stimulates the TCA cycle and inhibits ketogenesis. B. The increased NADH-NAD+ ratio leads to the accumulation of lactate and fatty acids. C. Ethanol metabolism increases the activity of acetaldehyde dehydrogenase. D. Ethanol metabolism inhibits the production of ketone bodies and fatty acids. E. Disulfiram is used to treat ethanol-induced metabolic acidosis. Answer: B. The increased NADH-NAD+ ratio leads to the accumulation of lactate and fatty acids. Explanation: ethanol metabolism increases the NAD+ ratio, which inhibits the TCA cycle and promotes the diversion of acetyl-CoA into ketogenesis and lipogenesis. This can lead to lactic acidosis, as excess NADH reduces pyruvate to lactate, and odd hepatic steatosis due to the production of fatty acids and triglycerides. A. The NADH-NAD+ ratio inhibits the TCA cycle, which leads to the accumulation of metabolites that are diverted into ketogenesis and lipogenesis. C. Ethanol metabolism increases alcohol dehydrogenase activity, but does not affect acetaldehyde dehydrogenase directly. D. Ethanol metabolism actually stimulates ketogenesis and lipogenesis due to the increase in NADH. E. Disulfiram blocks acetaldehyde dehydrogenase and is used to deter drinking, but it is not used to treat alcohol-induced acidosis. Question 3. A 30-year-old man is brought to the hospital after a suspected overdose of methanol. He is confused and his blood work shows an increased anion gap and metabolic acidosis. Which of the following treatments should be used to inhibit methanol metabolism and prevent further toxicity? Choices: A. Fomepizole. B. Ethanol. C. Disulfiram. D. Sodium bicarbonate. E. Vitamin C. Answer: fomepizole. Explanation: fomepizole is the preferred antidote for methanol or ethylene glycol poisoning because it is a competitive inhibitor of alcohol dehydrogenase, the enzyme responsible for converting methanol into toxic metabolites, formaldehyde and formic acid. Ethanol can also inhibit alcohol dehydrogenase, but is not the preferred treatment for methanol poisoning. C. Disulfiram is used to discourage alcohol consumption by blocking acetaldehyde dehydrogenase, but is not used to treat methanol poisoning. D. Sodium bicarbonate is used to treat acidosis, but does not address the underlying toxicity in methanol poisoning. E. Vitamin C is used in scurvy treatment, but is not effective for treating methanol poisoning. Question 4. A 40-year-old male with chronic alcohol use presents to the emergency department with confusion, nausea, and vomiting. His laboratory results reveal elevated lactate and an elevated anion gap. Which of the following metabolic disturbances is most likely due to the effects of ethanol metabolism? Choices: A. Hyperglycemia and lipogenesis. B. Lactic acidosis and hepatosteatosis. C. Hyperkalemia and increased protein synthesis. D. Decreased fatty acid synthesis and hypoglycemia. E. Decreased lactate production and inhibition of glycolysis. Answer: B. Lactic acidosis and hepatosteatosis. Explanation: the increased NADH-NAD+ ratio caused by ethanol metabolism leads to lactic acidosis due to the conversion of pyruvate to lactate and hepatic steatosis, fatty liver, because the increased NADH inhibits the TCA cycle, leading to the diversion of acetyl-CoA into ketogenesis and lipogenesis. This results in fatty acid accumulation and liver dysfunction. A. Hyperglycemia and lipogenesis are not caused by ethanol metabolism, and the effect is usually hypoglycemia. C. Hyperkalemia is not typically seen in ethanol-related metabolic disturbances, and protein synthesis is not primarily affected. D. Decreased fatty acid synthesis would be unlikely in this context, and hypoglycemia is more likely. E. Lactic acidosis occurs due to ethanol metabolism, not a decrease in lactate production.